Hey, Dr. Russell here at JAX Implants, and today I just want to make a video going over how to use your water pick. So for all of our implant patients here, we always recommend getting a water pick. This is going to be your best friend in terms of keeping the implant nice and healthy and clean. You're still going to brush the teeth, whether it's a single implant or a full arch of implant, you're still going to brush them to keep any debris off of them, but to really clean around the gums and below the gums, the water pick is going to be your best bet. There's tons of different options, doesn't necessarily have to be the water pick brand. Any brand is okay. There's multiple different kinds. You have the portable ones that you can take with you, use in the shower or whatever, and then you also have these bigger units. Personally, I like this bigger unit. This particular one we always recommend is the Waterpik Ion. It's nice because it's still portable, battery powered. You can also plug it in so you don't have to worry about the battery dying. And the big thing is it has a much larger tank. These portable ones, to get a bigger tank, they end up being really big and bulky, whereas this one, you still have the big tank, but you got the smaller wand to use. The Ion also comes with a ton of different tips, and most importantly, it comes with this implant tip that has this 180-degree bend in it, which we'll go over in a second. So for all of our patients that are getting their full arch implants, we recommend not using your water pick for the first 2 weeks after your surgery. While you're healing, we stitched your gums together. You don't want to go in there with a little pressure washer while they're trying to heal together and just be squirting water and kind of blasting them apart. So for the first couple of weeks, they're just going to be using warm salt water rinses, brushing the teeth, and that's about it. Now, after that 2 weeks, we're going to see you back for a post-op check, make sure everything is healing how we like it, and then go over how to use the water pick. So at that point, you can start using it. I recommend starting on the lowest setting. They've all got different ways to do this. On the portable one, the other reason I don't really love it is it only has a couple of different settings. Most of these bigger units have something from like 1 to 10, so a lot more adjustability on it. And I really like it because you can start off after surgery at a very low setting where it's very gentle. It's still gonna clean around the implants without shooting too hard where it becomes uncomfortable for you. Recommend just warm tap water in this. You can use mouth rinses and stuff like that, but really we're using this for just manual cleaning. So warm tap water works just fine. If you use something too cold, it can be a little sensitive in there, so that's why I recommend the warm water. So you've got, like I said, a ton of different tips. Our most commonly recommended tips are gonna be one similar to this, where it's got a little bit of an angle to it, and then the one where it's got the full hook tip on it. So whenever you're using, let me pop this one off here. This slightly angled one is the one that you're going to use for the outside of the implant. So you're going to come around your bridge and you're going to get up underneath your lip and just come all the way across. So you're going to get this to where the bridge meets your gums, and you're going to get right along that gum line and just squirting all through here. And usually recommend a few different passes to get through here. During your initial healing, obviously you'll be a little bit more gentle. You don't want to be jamming this up in your gums where you're sensitive. So just doing a few passes through there. After that, that's when you're going to switch to the other tip. And so the really big benefit on this one is you're able to get to the inside. So this tip, you can get right behind the implant bridge and then clean all alongside here. I would say this is the most commonly missed step, or step that's not done as well as it should be, because it is a little bit tricky, especially on the top. You can't really see where you're working with. And then on the bottom, people always miss kind of that front side by their tongue. So make sure you're using this tip, otherwise you just won't be able to get down there with it. Now, over your healing process, over those first 3 months, like I said, I recommend starting off on the lowest setting you have available. And then by about the end of that 3 months, you can kind of be on a medium setting. And then once we see you for your 90-day appointment after everything's healed, we may adjust that pressure. You tell you can go a little bit stronger or keep it where it's at. After you're healed, you can also start using, different mouth rinses, peroxide rinses, stuff that we'll go over with you, but I don't really want you using any of that during that initial healing period. So that's pretty much it in terms of the water pick. So if you have any additional questions on that, always feel free to ask, leave a comment, we'll get back to you on it. But overall, pretty simple and straightforward. The main thing is just making sure you're using it at least twice a day. I've got some patients that do it, 3, 4, 5 times a day. That's great too, but at a minimum, twice a day, every single day, that's gonna keep your implants nice and healthy and make sure they last you as long as possible.